continence is provoked by different medical conditions. The majority of individuals have partial damage to the nerve pathways and suffer neurological problems or spinal cord injuries. Some people urinate without noticing. Some people do not feel any urgency or cannot void completely. Users can place Noui around the bladder. The tiny device sends a low-frequency electronic signal that passes through the bladder and estimates fluid amount by the comparison of the electronic signal strengths obtained from the two electrodes placed on the abdomen and back with the bladder in between. With Noui, users and healthcare staff can monitor users' fluidity. When the signal reaches the thresholds, a warning is sent to the user or the user's caregiver to notify the time for toilet function. The hospital staff can continuously monitor patients' urine amount and offer urgent treatment for the patients with abnormal urine residual and overflow. We promote continence and care about safe hygiene.